So what do you think about gut health and probiotics? Should everybody be eating live culture yogurt every day and taking probiotic supplements? There's all of this kind of explosion in the last couple of years about how all diseases are going through the gut now. And what do you think about all this?
I am so excited about gut health. and so that was another nerdy answer, wasn't it?
It's great, but you want your dietitian to be able to geek out a little bit, for sure.
I think that this is an exciting time for us as people in the medical world, because this is like the tip of the iceberg.
It's the beginning.
It's the beginning. And sometimes that frustrates people when I talk about it, because I don't know all the answers yet, right? We don't know what strains of bacteria, et cetera, are helpful. But here's what we know.
Okay.
We know that inside our gut are good, healthy bacteria. They're supposed to be there. People freak out when I tell them that, like it's a problem.
And by gut, we mean stomach, small intestine, and large intestine.
Specifically, we're talking about colon, the lower part of your intestine.
The large intestine. Okay.
Yes. And so there is good, healthy bacteria. And this bacteria is a crucial role in our immune system. It's a crucial role in us being able to make some nutrients for our body. It's a crucial role in digestion. And it's something that was really undervalued for a really long time. And what we are starting to see in the research is that having an imbalance in your gut bacteria, whether that's not enough of certain kinds, not enough variety across the board, having certain imbalances in your gut is related to a host of all sorts of things, right? Autoimmune issues, brain issues, cancers, etc. And I think that there's a time, probably in our careers, when we're like an old doctor and an old lady dietitian. We'll be in
I don't know how I feel about that when I'm going to be.
We'll be in rocking chairs as we're talking about this.
You remember when we talked about those probiotics? Oh, man.
But there will be a time when you go to your doctor, and this is what I believe, that you can look at the bacteria in your gut and you'll be able to say, oh man, that you don't have enough of this one. Or
my lactobacillus is low. Of course I'm sick.
Of course. So in the meantime, what do we do about it? What's the takeaway?
Yeah, what are you telling your patients about it as a dietitian?
So from the standpoint of maintaining the good bacteria that you have, diet is huge. It goes back to, now this is going to sound familiar, it goes back to the importance of vegetables.
Shocker, right?
Healthy fats, okay, good quality proteins, focusing your diet around those things, and then really trying to minimize the processed carbohydrates and sugar. What we know is that sugar and super processed carbohydrates, so chips, cookies, crackers, all of this stuff.
Cheetos. Right, junk food.
This stuff feeds what we are thinking is your bad bacteria, which can overwhelm the good bacteria.
Kind of the balance.
Yes.
It's almost a battle of good and evil in your gut.
Exactly. Exactly. And so yet another reason, we've talked about this protein, fat, veggie idea for weight control. We've talked about protein, veggie, fat idea for blood sugar control and diabetes. Guess what? Protein, veggie, fat for a healthy gut, right? It's all the same story.
It's all kind of connected, yeah.
In addition to that, there are foods that can help maintain, and I'm reluctant to use the word repopulate because I think we're thinking about that wrong. But we can ingest good, healthy bacteria to make sure that the balance is right. And we get good, healthy bacteria from foods like fermented foods, so kimchi, sauerkraut, miso.
I don't even know what these things are and how to put it in my diet.
live active culture dairy products are usually a little bit more approachable for people.
The yogurt I've got.
Have you had kefir yet?
I don't even know what it is.
So kefir is a cultured yogurt drink. It's the consistency of a smoothie.
Okay.
But it has, up to 20 or some odd strands of bacteria, good healthy bacteria.
Kefir.
Kefir.
Okay.
You can get it at any grocery store.
Okay.
It's widely available. And again, all of these are going to help introduce really, really good bacteria. One of the reasons that you and I first started talking about good bacteria was in the hospital setting with our patients who are on antibiotics.
Totally.
So you prescribe antibiotics.
That's
why?
like an extreme example
Yes.
of antibiotics kill bacteria, and they don't know good versus bad, so they wipe out a lot of your gut bacteria.
Yeah.
You're at a risk for horrible diseases in there.
Right.
C. diff and antibiotic-associated bacteria.
Diarrhea.
So we would always talk about...
So I would either get every patient on an antibiotic, live culture yogurt, or I was always bugging you about probiotics. You love that. But I think it's important for those of you at home to know that if you go to the dentist and you're put on a 3-day course of antibiotics, eat some yogurt every day for a while.
Totally.
If you're put on a 7 to 10 day course of something for strep throat, have some yogurt. It certainly can't hurt. Because you're right, those antibiotics don't discriminate, right? They're just going to obliterate everything.
They just wipe everything out. Should people take probiotics? Do you take a probiotic pill? What do you think about that?
I don't. I take probiotics if I'm ever put on antibiotics, but that's
Makes sense.
Few and far between. I think that eating live, healthy cultures in food form, you get the whole picture, right? You get the benefit of the protein and the calcium and the other nutrients in the yogurt.
You get it all.
And, supplements probably are a whole nother topic, but I think there's some really good ones out there, right? There's probably some that most people need to be taking, vitamin D, fish oil, stuff like that. But we need to be really careful about blanket recommendations because everyone's different and the supplement industry is not regulated, so it's a little bit of the Wild West.
It's not the most trustworthy sell you something group of folks.
So to answer your question, getting probiotics from pill form is one of my least favorite options. However, if you don't eat dairy or you don't like these foods or you need, if that's the best option for you, then what I really recommend is that you do a little research and find companies who can show you that they've done research on their supplements. There's been articles out there where, they go to local drugstores, buy the supplements off the counter and find that they're all dead, right? You're ingesting nothing. Whereas there are companies, right? These are usually the more expensive companies, the probiotics you're getting in the refrigerated section, etc., that seem to be legit. And those are the ones that if you're going to take them, don't save money and by consuming something that's not going to help you out.
Certainly Whole Foods, always a good way to go.